Hello, thank you for attending today. I hope you all leave here today a bit more knowledgeable and more inspired and feeling more connected from everything that's been presented and shared here today. I would like to acknowledge also it's Are You OK Day. In asking people, are you okay, you will never know what kind of impact you may well have had on their life. Part of the inspiration of this work for me is a friend who did take her own life after her breast cancer treatment, and I certainly wish that I asked that question. So please do so in your professional life, but also in your personal life as well. It would be remiss of me to say, though, that it was only one person that's inspired me to do this work. Over the sort of decade and a half that I've done radiation therapy, there's been many, many patients and many, many health professionals that have motivated me and inspired me and contributed to this work. My supervisory team also, Hariana Dillon, Diana Nayrig and Georgia Halkett have contributed substantially to this work and also to motivating me to complete it. So I want to acknowledge the decades of experience amongst that team in psychology and radiation oncology and radiation therapy. And what we have decided to do with this project is to look at what radiation therapists know about patient anxiety. So I'd like to present some of the results that we have from this project so far. The aim for the project was to determine what radiation therapists know and what their level of confidence is in detecting and managing patient anxiety. Going through any form of cancer treatment, including radiation therapy, is a big deal for people. So we wanted to explore a little bit more about how this particular group of professionals can assist people through their treatment, and also knowing that from working in this area and from the research and from all of the anecdotal evidence and stories that we've heard in doing this work, this impact on people starts from before their cancer diagnosis, and all of these impacts continue throughout their treatment and well after treatment as well, which is something that I wasn't quite aware of before conducting this work. Of course, we consulted the literature and sort of worked out that what we were seeing in clinics and our experiences with patients were not uncommon. So many people had unmet psychosocial needs throughout their treatment course and throughout after their treatment as well. Psychosocial services are often under-resourced or difficult to access, and some of those access issues are not just around physical barriers, but also around the stigma that's affecting our society in asking for help. Communication skills don't improve with experience alone with our healthcare professionals, so we need to support our healthcare professionals in turn to support our community and our patients. And also the psychosocial care guidelines that we have in Australia and also internationally are saying that it is the responsibility of all healthcare professionals to assist our patients in terms of psychosocial care. And that kind of really mirrors what was discussed this morning too, in terms of it being all healthcare professionals' role in smoking cessation. So we've got a big duty as healthcare professionals, and a lot of areas that we are stretched across, but we also need to have the knowledge and the skills and the understanding of what we're doing and why we're doing it. So just to give you a bit of an update, we've done a systematic review. We then developed a survey to address some of the issues and the gaps in the literature. We conducted a survey pilot, which I did present on last year, so hopefully some people have a bit of insight into that process as well. We launched the survey internationally, and then we have been analysing the results, and we're still in that process, but I'd like to share some of those with you today. In terms of the systematic review, we were looking specifically for radiation therapist-led intervention that had some form of reported impact on patient anxiety. And initially, when we searched all the databases, we found about 261 publications. When we compared that to our predetermined criteria, that came down to 10 publications that were looking specifically at what radiation therapists do and what that impact is on patient anxiety. And as our previous presenter was just talking about, making someone feel safe and cared for is actually a really massive part of helping people through their treatments. And there's no difference with that in terms of radiation therapy in all of our patients. So in terms of providing education and information, in terms of developing these relationships with patients to help them feel supported, and also to use screening needs and assessment tools were all the different things that we found in our systematic review that is helping to decrease patient anxiety. Of course, there were lots of gaps, and so we needed to sort of further explore things around what the expectations are of radiation therapists, what their level of communication skills are in order to help their patients, how they use screening tools and if they value screening tools. Referral pathways, which is something comes up if we detect that there is some form of issue, what do we do about that? How do we seek care and guidance for our patients? And then how do we actually implement change? What are the strategies that are being used? So in developing our survey, we tried to address some of these questions, and obviously we couldn't address all of them, but we gave it a good go. We developed a survey on Qualtrics, and we had University of Sydney ethics approval to go through with this process. And we were asking radiation therapists to provide some demographic information, some information about the training that they've received and any communication skills training. We had some vignettes within that survey to try to assess people's knowledge of anxiety. We also asked people about their work processes and their work resources. And we also tried to ascertain radiation therapists and the stress levels and potential burnout levels that these people are experiencing in their jobs. So we piloted the survey with some radiation therapists within New South Wales, and we also circulated that to some medical radiation professionals in the professional associations to provide feedback to us. We implemented that feedback, and then we actually launched our survey last year. The survey went out to radiation therapists in Australia, New Zealand and Canada. And the reason that those 3 countries were chosen is because in terms of their practice and their training, they're quite similar. And also in terms of their interest in patients and psychosocial care, by assessment of the number of publications and the information coming out of those countries, that all seemed to be quite similar, and we felt therefore that these 3 groups had something very significant to contribute to our survey. It was promoted by email and through professional associations and research networks. So we get to the results. 859 people clicked on the survey link. Not everyone went through to do the survey, and so we removed people that didn't go from start through to finish, and also removed anyone who was not from one of those 3 target countries. All in all, we ended up with 582 data sets that we've used for analysis. So it was a substantial number. It was a long survey, and we're very grateful for all of those who contributed, and I'm sure there's some people, hopefully some people that I can see in this room that have done so. And it's one of the largest studies, or it is the largest study that we know in surveying radiation therapists in this way. We grouped people into Australia, New Zealand and Canada for the purposes of our results, and the demographics of those groups are quite similar. So we had a high female response rate, which is quite typical in radiation therapy surveys from what we could see from the literature. We had about 2/3 of our group were working full-time, and we had a really broad range of age and experience, ranging from people who were just starting out as radiation therapists all the way through to those that were actually retirement age. So we had a really broad group of people contributing to this. One of the things we asked people was to list signs of anxiety. So it was free text. And what we found was that almost 90% of our radiation therapists were able to list signs of anxiety. And in fact, the majority of those listed 3 or more signs. Of the signs that people listed, which was over 2,000 signs, only 24 of those were uncodable. So we actually took all of the signs of anxiety and grouped them into different themes. So from that, it appeared to us that people had a really good grasp of the theoretical aspects or the theoretical signs of anxiety. And just to run through a few of those signs with you, agitated and nervous type behaviour was most highly endorsed. Following that was physical signs of anxiety, so things like sweating, increased heart rate, changes in breathing patterns, dryness of mouth, panic attacks. The sort of next one that was had the most number of responses was withdrawn and avoidant type behaviours, so people that weren't able to engage, and also people that perhaps didn't turn up for their appointments or would turn up just on time, just enough time to get in the door and then get back out again and have done what they needed to do. And then there was other ones as well, so distracted type behaviours and inability to focus. We had another group that was around crying. We had another group that was around emotional moodiness. Another group around angry and rude type behaviours. Also people reporting that issues with sleep as a sign of anxiety. And I think that's the last one. So in terms of radiation therapists' confidence in dealing with patients with anxiety, I found this quite interesting. In dealing with patients every day as a radiation therapist, people are at various different stages of their treatment, and we do tend to see that people's anxiety levels are higher at the beginning of their treatment. They sort of tend to settle down a bit once they get into the routine of daily treatments. Once side effects appear, the anxiety levels tend to go up a little bit. People tend to settle down again as that gets managed. And then as they get towards the end of their treatment, anxiety levels tend to pick up a little bit because they're wondering what's going to happen next when they leave this environment. So realistically, radiation therapists are dealing with people facing anxiety every single day. Yet in this case, people are reporting that they're only somewhat confident in dealing with patients with anxiety. And I think that's of concern. In terms of communication skills training, so training sessions where you are learning to see and recognise and respond appropriately to people's verbal and non-verbal cues is what I'm referring to with respect to communication skills training, and it's not something that forms the basis of everyone's training. Over 57% of people reported having completed communication skills training, and there wasn't really any there was a difference between countries in this case, and I think this is actually probably related to the RT Prepare trial that's being run by Georgia Howkett, and she was actually putting radiation therapists through communication skills training. So I think that that's had an impact on our results there. We also asked people if they had a perceived need for communication skills training, and this was quite a strong response. So almost 80% of people said there was a moderate to strong need in their role as radiation therapists to complete communication skills training. And there was no difference between the countries here. And we thought there's no point in asking them just about the need, also asking them about their motivation was important, and over 80% of people said that they thought there was a strong to moderate need to complete the communication skills training. Again, no difference between the countries here. And the perceived need and the motivation were related, so the higher your perceived need to complete communication skills training, the higher your motivation, it was more likely that you would have a high motivation to do so. If you didn't see that there was any need for you to complete this type of training, then you didn't have a very high, or it was more likely that you didn't have a high motivation to complete. So we need to acknowledge the limitations of what we've done so far. We're unable to determine an exact response rate because we don't actually know how many people received the invitation to participate. There's also potential responder bias because it is a survey. We have the high proportion of female responders, and that may have influenced our results, but we're not able to ascertain that at this point. It was a lengthy survey, and that may have discouraged people from participating, as the nature of the questions being quite personal, such as asking you if you'd experienced anxiety or if members of your family have experienced anxiety, and questions like that may have stopped people from completing the survey as well. We also didn't ask people to report what geographic region they were working in, and so we can't say that the knowledge of availability of psychosocial services, for instance, there's high awareness in metro areas compared to rural areas or in certain different places comparatively. So in conclusion, what we can say at this point is that radiation therapists seem to have a really strong knowledge of theoretical signs of anxiety. They are somewhat confident in dealing with patients with anxiety, and I would say that this really needs to improve. Approximately half of the radiation therapists have completed communication skills training. Again, it would be my viewpoint that we need to train the other half in this area as well. And RTs tend to identify a moderate to strong need and a moderate to strong motivation to complete communication skills training. So we have a workforce of radiation therapists that are really keen and see the relevance of this type of training and want to know how they can better improve the services to their patients. There was no clear differences between the countries in the analysis that we've done so far in terms of radiation therapists' confidence in dealing with patients with anxiety or their need or motivation to complete communication skills training. So from my perspective, all three countries are in the same boat at the moment. There's a lot of momentum here, there's a lot of motivation here, but we're all starting from the same platform. I do have a couple more things to analyse at this point. The impact of patient anxiety on the staff and on the services. Also radiation therapists' referral practices and awareness of the psychosocial support services that are in their area, and also what impact it's having on the radiation therapists. I'd like to thank you all.